Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist with a medical practice in New York. This episode is all about alcohol. Specifically, we're going to talk about the harms associated with drinking alcohol. If you really enjoy drinking, you might want to tune out now. However, if you do really enjoy drinking, it's especially important that you keep listening to at least understand the far-reaching ways that alcohol affects your body. Today I'm going to define the amount of alcohol considered as light use, moderate use, and heavy use. And I'm also going to review the myriad ways that alcohol can cause harm in your body. And we're going to discuss some simple questions that you can answer for yourself or a loved one to see if you may have an alcohol use disorder. Even if you don't drink, this episode is important to listen to because alcohol affects us all in one way or another. So what got me thinking about alcohol? I was on call recently, and I got called about yet another patient in the hospital with some type of horrible problem related to a history of heavy drinking. And I had to go in and see this person who was bleeding uncontrollably and had to do some procedures to stop the bleeding. And we're not talking about this case today because it's too recent to cover on a podcast like this, but I do want to talk about a similar case that I saw a few years ago in the hospital. And this one I remember vividly because it was another bloodbath type case. And I'll tell you all about this gentleman right now. But first, I must inform you that this following patient case is based on a real patient. Some details may have been changed to protect patient privacy. So I was called a few years ago to see a 62-year-old man who was in the ICU in the hospital. And this was about 10 o'clock at night. The patient has a history of liver cirrhosis from alcohol, and he was still drinking alcohol at the time of his hospital admission for vomiting blood. He underwent a procedure to control the bleeding earlier in the day, which is called variceal banding. So he had an endoscopy, and several rubber bands were placed on these bleeding varices in his esophagus. But it didn't work because later that night he started bleeding again, and there was a massive amount of bleeding. He was vomiting blood. Blood was coming out from the rectum. His blood pressure was very, very low, and he was too ill to undergo any type of bedside procedure. An endoscopy or anything else was not going to be tolerated. There wasn't even enough time to get the cart up to the room. The guy was bleeding out so much. So he had some large IV access ports that were infusing blood. He was on medicines that try to keep his blood pressure up. He was intubated orally, so his airway was protected, and he was basically in a coma while this was happening. So this is like a true, real deal medical emergency. And as a last-ditch effort, we placed what's called a Blakemore tube, which is a large tube that goes down the esophagus into the stomach, and you inflate a balloon with air in the stomach that's about the size of a grapefruit or even a little bit larger. And then you put traction on the balloon and it pulls up against the stomach where the esophagus and the stomach meet each other at the gastroesophageal junction, and it puts pressure on the veins that are causing the bleeding, that are feeding the varices in the esophagus. And typically that does stop bleeding. But in this gentleman's case, instead of having the bleeding stop, he expired right then and there of a cardiac arrest due to low blood pressure from his massive bleeding, because it was a case of too little, too late. So we treat these kind of things as emergencies. But in fact, this gentleman's demise was a slow-moving train that started somewhere 30, 40, something odd years ago, and progressed towards the point where he is bleeding out and nothing works and nothing will stop it. And this kind of tragedy starts at a young age when he was drinking, and the alcohol slowly damages his liver year by year, and eventually he develops alcoholic liver disease, and then cirrhosis, and then decompensated cirrhosis, and then this is like the end stage of all of these bad things happening. So when this kind of thing happens, it's not a surprise. It's no more a surprise when the sun rises in the east or when the hurricane comes that was predicted by the weather station. and brings strong winds and rain. And you can't act like that's a surprise because it's predictable. And so is this kind of problem with alcoholic liver disease. His fate was kind of sealed when he came into the hospital with end-stage decompensated cirrhosis at the end of the line with nothing else working, too sick to be transferred for some other procedure and too sick to even undergo a regular endoscopy. And it got me thinking about how much heartache and bad outcomes happen because of alcohol. And someone else thought of this too, because there's lots of information on this out in the literature. So I found a paper that I'll link in the show notes below that looks at the estimated deaths attributed to excess alcohol use among United States adults from the ages of 20 to 64 years of age. And this data was collected in 2015 and it spans to 2019. So it's pre-pandemic data. And what they say at the end of this article is that, in fact, all the signals now say that the amount of alcoholic liver disease and other problems related to alcohol increased dramatically after the pandemic. And I'm sure there's some research coming out on that, but this is what I was able to find, and it explains our point very nicely. So I'm going to go through this paper in about 2 minutes, and it's kind of interesting that the magnitude of the problems that come up with alcohol use are way higher than I thought they were, and probably way higher than you thought they were as well. But the authors of this paper are saying that an estimated 12.9% of deaths per year are attributed to excess alcohol consumption. That's a ridiculously high number of people dying from alcohol use. And these are not all direct deaths, like direct alcohol poisoning or alcoholic liver disease only, but they tried to estimate the amount of deaths from all the things that alcohol can do to the body. And we'll review that a little later in this show. And the other interesting takeaway from this paper was that from adults aged 20 to 49 years of age, so relatively young adults, the alcohol attributable deaths were up to 20% of people who died in that age group were related in some way to alcohol. So that's like a staggering number of people are dying from drinking alcohol. So how does alcohol kill you? That's kind of like the bottom line, and that's kind of the point of this whole talk. How do people, we all know that drinking excess alcohol is probably not great for your health, but how does it actually kill you? Not everyone just dies of alcohol poisoning. There's so many other ways that it damages the body. So let's take a look at that in the next 15 minutes or so. And I always say 15 minutes, and I'm probably going to go longer than that because I have no concept of time. But anyway, let's get into it. So all kinds of things can be caused by excess alcohol use, including heart disease, cancer, all kinds of injuries, and especially liver disease. So there's the fully attributable causes, meaning things that are directly, you can point at them and say, this is directly a result of alcohol, so like alcoholic liver disease or a drunk driving accident, like that's clearly alcohol at play. And then there's all the other indirect causes of alcohol where alcohol is related, but not necessarily, you can never say it's 110% caused by alcohol. And these are cancers, heart disease, other situations. So through some mathematics and some guesstimates, they come to these numbers. They're never really exact numbers, but they look at what people report that they drink, and then they look at how many units of alcohol are sold in the country, because a lot of people underreport what they actually drink. And the heaviest drinkers are not filling out surveys for these authors' research. They're not responding to these surveys because they're drunk, and they're not really like in the mindset to participate in random research studies on alcohol. So what people actually report is probably a gross underestimate of how much people actually drink. So these authors tried to correlate what's actually reported with how much alcohol is actually sold in the country and consumed. And they tried to figure out some mathematical calculation to make these numbers more realistic. So the leading causes of alcohol attributable deaths are basically, and they're the same for men and women, which is interesting, but basically it depends on the age group. So younger people tend to get problems that are more acute related to alcohol. So one of the highest risk when you're 20 to 34 years of age in terms of death from alcohol is poisoning, meaning direct poisoning from drinking way too much alcohol and combining with other drugs, and then motor vehicle crashes, so drunk driving accidents, and surprisingly or not, homicide was the other leading cause of death. So Someone drinks too much, they get in a fight. Someone drinks too much and they get violent, and someone dies. And that's one of the major causes of alcohol-related death in 20 to mid-30s, which is a little scary, and it makes you want to stay away from people who ingest too much alcohol, or settings, social settings where there's large groups of people who are just drinking tons of alcohol, because the risk of all kinds of bad things goes up. All kinds of accidents, fights, murders, poisonings, etc. So not a good scene. And if you go to the next age group, 35 to 49, these are people who are a little maybe more mature or have been drinking for a longer period of time. So other diseases start to creep up into the numbers here. And other poisonings is still up there on the list. So that's just alcohol poisoning associated with other drugs as well. Alcoholic liver disease now enters the picture, where you've been drinking for long enough, where, if most people start in their teens or 20s drinking, you've now been consuming alcohol for 20 years or more, and that's how much time it takes often to get alcoholic liver disease, which we'll cover in a little more detail, and then car accidents. So the homicide thing drops down in the list, and the top three are other poisonings, alcohol plus other drugs, alcoholic liver disease, and motor vehicle accidents. And then if you make it to your 50 to 64, and want to die of alcohol, then liver disease comes right up front. So alcoholic liver disease, still other poisonings, meaning combining alcohol with other drugs and just being so intoxicated that you stop breathing, and then liver cirrhosis. So that's when you've lived long enough and drank long enough to actually develop end-stage liver disease and cirrhosis. And that's what this gentleman in our case eventually succumbed to, which was sequelae from liver cirrhosis. And he was in that age group as well. So it takes a long time to get cirrhosis unless you're really trying to kill yourself with alcohol. And this is the age group that comes, 50 to 60s is the age where you start to see major issues related to cirrhosis. So as you get older, you have less of a chance of dying of a homicide from alcohol and more of a chance of just plain old-fashioned liver disease. But the numbers, I think, are staggering, and it also depends on the state that you live in. So it's very interesting. The state that I live in, that I'm doing this podcast from right now, and where I treat patients, is New York. And in New York, the risk of dying of some type of alcohol-attributed cause is somewhere in the middle of the country. It's about 11.2% in the groups of 20 to 64-year-olds. Now, if you go to New Mexico, that's the highest in the country. That's about 22% of deaths in that age group are attributed in some way to alcohol. But if you lived in Mississippi, apparently that's the lowest chance, and that's 9.3% of people. Their deaths are somewhat attributable to alcohol in that age group of 20 to 64. And it varies. Every state's somewhere in between that range of about 9.3 and about 22%. So it depends where you live. It probably depends on local culture and customs and norms and how much people are drinking and what else is going on. But the numbers, regardless, are very high. And it kind of is amazing that nobody talks about this. Maybe we don't want to talk about this because it's an inconvenient truth, but there it is. So alcohol, it's bad for you, but we know that already. And some of this obviously is a magnitude thing where the more you drink, the worse it is. But I'd like to talk in the rest of the time that we're going to take here about the other things that can happen when you drink alcohol in terms of other bad things that can happen. So we talked about just overall mortality, how alcohol is related to a very high number of deaths per year in some way or another. But let's break down the other ways in which alcohol can kill you. So liver disease is the top of my mind because as a gastroenterologist, we treat a lot of people with alcoholic liver disease. It becomes almost like a specialty of gastroenterology, is treating all the alcoholic liver disease out there. And it's rampant. We see it in every community, in every social situation, in every race, in every sex. It's a disease that you cannot get away from. And it really does not care whether you're rich or poor or young or old. It's kind of humbling in that department. People drink different types of alcohol, but it all affects them the same way. And I see cirrhotics from all walks of life. So how does it happen? Initially, when you drink too much alcohol, you develop fatty liver, which is when your liver swells and becomes dysfunctional and your liver enzymes rise, but no real damage has happened yet, or at least no permanent damage has happened yet with fatty liver for the most part. But it's a spectrum, and slowly you slide into alcoholic hepatitis if you drink enough. And we'll cover alcoholic hepatitis on a future episode in either next week or the week after that. And that's a whole another beast that we're going to talk about in detail, alcoholic hepatitis. But basically, when you drink too much alcohol for too long of a time period, you can develop this acute necro-inflammatory state in your liver where the liver cells start to die off and major inflammation changes happen where it affects the entire body and quickly progresses to death unless you stop drinking alcohol. And you turn yellow and you get quite sick, and it's a really terrible disease. But I have a whole episode on that, so let's touch on that another time. And then cirrhosis. When everyone thinks of alcohol, they think of developing cirrhosis. So that's like end-stage liver disease, scarring in the liver. You develop eventually ascites, where you develop fluid in the belly, and that has a look to it that most people can spot from far away once you know what it looks like. Someone looks frail, they have a large protuberant abdomen, they have skinny legs and arms, and sometimes they turn yellow toward the end of it. They have muscle wasting, and it's a bad disease to have, especially when you're still drinking and have cirrhosis. That's the worst combination. So how do people die from cirrhosis? Well, they die from cirrhosis in many different ways. It's basically it's a very, very important organ in your body that's not working anymore. So you develop liver failure, which can lead to a coma and death. You develop something called hepatic encephalopathy, where your body doesn't break down toxins normally, because the liver's role, amongst other things, is to break down toxins, and many things build up in the bloodstream, and we can measure the very high ammonia levels in the blood. And that causes confusion and other major issues, including you can slip into a coma and die if it gets too high and doesn't get treated in time. People also develop bleeding issues, like the man from our case earlier, because the pressures in your liver, or the pressures of the blood flowing trying to get through your liver, because it can't, because the liver's scarred, the pressures rise very high in what's called the portal system, and your body finds different ways for the blood to travel around the liver instead of through the liver. And one of those ways is through the veins that travel through the esophagus, and they develop very high pressures, and they're not made for that, so they burst and you bleed. And that's fatal many times, even after the first episode. You also get infections. So people get infections in the fluid around their belly. It's called SBP, or spontaneous bacterial peritonitis, and that also carries a high mortality rate. You can also develop what's called hepatorenal syndrome, where your kidneys shut down because of problems with the blood flow. And this is all related to the liver disease as well, and it often progresses to kidney failure very quickly, and is often a cause of death in people with decompensated cirrhosis. And you can also develop liver cancer, and that can cause its own problems that also lead to death at some point if not properly picked up and treated early enough, or if the patient's not well enough to be able to withstand the treatment. And then there's all the other miscellaneous stuff that can happen. So people with cirrhosis fall commonly. They have poor muscle mass. They have a big belly in front of them full of fluid that's dragging them down. They're deconditioned. They may still be drinking. They may have encephalopathy and confusion and poor sleep and other issues, and falls very commonly take people out. There's other kinds of infections that can happen, like pneumonia and other forms of infection, sepsis, urosepsis, etc., that happen more commonly in patients with cirrhosis because they're a little bit immune compromised from their disease. There's heart failure, which you often can get related to alcoholic heart disease or alcoholic cardiomyopathy, and cirrhosis and heart failure is a very bad combination. And then there's all other miscellaneous diseases and cancers that are increased when you have liver disease and a chronic history of alcohol use. And then speaking of cancer, that's another way that alcohol affects us. And I think this also is understated often. People always think you drink too much alcohol, you get liver disease, and that's kind of how it affects you. But people forget about the cancer thing. And the cancer thing is huge with alcohol. I think we do a very poor job in discussing this with patients, and I think we do a very poor job of publicizing the risk of alcohol and cancer. So first, before we delve into this briefly, we should talk about what constitutes, when you look at research studies, what constitutes different levels of drinking. So light drinking, moderate drinking, and heavy drinking. I think we also tend to underestimate what is considered moderate and heavy drinking. And if you listen to these definitions that they use in research studies, some of this is a little scary for the people who drink a little bit. So moderate drinking is considered 1 drink or less per day for a woman, or 2 drinks or less per day for a man. So if you're a woman and you have 1 to 2 glasses of wine most nights of the week, you're drinking more than moderate drinking. Light drinking is just occasionally having 1 drink here and there. It's like barely having any alcohol. So moderate drinking, 1 drink for a woman, 2 drinks for a man, or less. Heavy drinking, at least in research studies, they define it for women as 4 drinks in a day or more than 8 drinks in a week. And for men, they decided that this is 5 drinks a day or more than 15 drinks in a week. So if you binge drink on the weekends and you have 7 or 8 beers 2 days out of the week, that's considered heavy drinking for these research studies. If you drink a couple of glasses of wine most nights of the week, you're at least a moderate drinker, but maybe a heavy drinker, depending on how many nights a week that is. So now let's look at the different cancers, and we're going to break them down by moderate and heavy drinking. So moderate drinking is associated with lots of different cancers, and heavy drinking is associated with the same cancers, but just multiple times more dangerous. So when we look at alcohol, you take alcohol in through your mouth, at least that's how most people do it, and mouth cancer and throat cancer, or head and neck cancer, is increased by moderate alcohol intake by about 1.8-fold. So almost 2 times as likely to get head and neck cancer by moderate alcohol use. That's just like not that much alcohol. You can have a couple beers here and there, and that's moderate. Heavy alcohol use, meaning you're drinking more than 8 drinks a week for a woman or 15 for a man, that can increase the risk of head and neck cancer by 5-fold. That's a huge increased risk. If we look at laryngeal cancer, it's similar. It's about 1.5 times more likely if you're drinking. And when we look at esophageal cancer, alcohol increases the risk of esophageal cancer, even with just light use, by about 30% from baseline. But with heavy use, it's 5 times more likely. So you're 5 times more likely to develop esophageal cancer with heavy alcohol use. Liver cancer is about 2 times increased with alcohol use. And colon cancer, which I like to tell my patients, but is not as well publicized, is that colon cancer and rectal cancer are also increased by moderate or heavy alcohol use. Moderate alcohol use increases the risk of colon cancer by about 1.2-fold, and heavy use increases it by about 1.5 times. And other cancers like pancreas cancer and maybe stomach cancer are possibly linked to alcohol use, and there's some data out there for it, but it's not as well established, so it's not listed with statistics like these other ones are. But pancreatic cancer and possibly stomach cancer are also related to alcohol use. So that makes sense. It's a lot of these GI organs that are associated with alcohol metabolism, or they're coming in direct contact with alcohol. But what I think a lot of people don't also talk about is the risk of alcohol use with breast cancer. So breast cancer, everyone comes in concerned with their breast cancer risk, and rightly so, because it's like the number 1 cancer killer in young women. And we talk about all these other factors for breast cancer, but we fail, I think at least we fail as clinicians, to talk about the risk of alcohol. So heavy alcohol use for a woman, it increases the risk of breast cancer by about 1.6-fold. That's a significantly increased risk. If you're looking to cut your risks, if you're coming from a family that has breast cancer in the family history, or if you're concerned because other medications you're taking may have been associated with cancers, or foods that you're eating, you're concerned in asking about these questions about what food should I eat to prevent cancer, and these anti-inflammatory foods, etc. I think we're failing to realize that lots of people out there are drinking alcohol. Moderate use of alcohol increases your risk of breast cancer by 1.23-fold, and heavy use 1.6-fold higher risk of breast cancer. So I think that's one of the big things to address, is that people who are very concerned about their breast cancer risk, or have had breast cancer and trying to avoid it, or their parents had breast cancer, or their mom had breast cancer, alcohol use, low-hanging fruit, stop drinking. Or, drink occasionally, meaning literally at an occasion, when you go to a wedding or a graduation party or it's your birthday, but not every Thursday, Friday, and Saturday. It's too much. And then there's some other things: ovarian cancer, small bowel cancer, prostate cancer, uterine cancer, and melanoma. They're all somewhat potentially linked to alcohol use, although the data is not entirely out there to cite specific numbers. There's definitely a suggestion that alcohol may be linked to some of these other cancers. Heart disease. So alcohol can cause heart failure. You can develop what's called a dilated cardiomyopathy. The alcohol is toxic to your heart muscle and it pumps less effectively. And your heart muscle dilates and it's ineffective and not working properly and causes heart failure. You develop fluid overload in your body. Alcohol can also, or especially earlier on in the course, is a common cause of hypertension, which is high blood pressure. So young people coming in with high blood pressure, one of the great things you can do besides cutting out your salt and losing weight is to cut out alcohol. And it also is a big risk for stroke. So young people coming in with high blood pressure and alcohol use are at high risk of strokes. And this stuff gets you often before the liver disease and the cancers and the other things. So these are the things to also watch out for. When I see young patients coming in with blood pressures of like 160 over 90 or 160 over 110 or something like some of these crazy numbers, a lot of times it's related partially to alcohol consumption. So let's look at some neurologic issues that come up with alcohol. So alcohol affects acutely when you drink. Everyone knows it affects your balance and maybe your memory if you drink too much, and your speech, and definitely your judgment. So you can fall, you can get into accidents, all kinds of bad things can happen. You can make really stupid decisions and hurt yourself or hurt your loved ones or die in some type of accident because you drank too much and drove a car or jumped off a roof for a YouTube video or got into a fight with someone who was having a bad day that day and decided to beat you to death. These are all horrible things that can happen if you drink too much. Blackouts can occur when you can't even form memories from too much drinking. And then overdose and death from just toxic levels of alcohol. College kids die like this. Young adults die like this. You get brainstem depression from toxic levels of alcohol in your body. You're not breathing. You can't protect your own airway. You choke to death in your vomit. You can't regulate your temperature anymore, your heart rate. You have seizures, whatever happens, and you die. Terrible way to go, although I guess you don't feel it when it's happening. We also should talk about withdrawal syndromes. When people decide they want to stop drinking, when they're drinking excessively for a long period of time, the alcohol withdrawal can be quite dangerous, and you could also develop seizures and other problems, and that potentially could be fatal. So if you're drinking tons of alcohol and you want to stop, you really should do that in a medically supervised setting, often a hospital or with some type of medication to taper down to help with the withdrawal symptoms, because alcohol withdrawal is a dangerous withdrawal, unlike some other drugs, which are just uncomfortable. Then there's all the chronic neurologic stuff that you see from alcohol. And I think the biggest one is brain damage. You see physical brain damage from excess alcohol use. People call this alcoholic dementia, but if you look this up, a lot of places call it alcoholic brain damage because it's not really dementia in terms of dementia continues to progress and get worse as you get older. Where alcoholic or alcohol-related brain damage, it's a physical loss of neurons in your brain. Alcohol causes shrinkage to the brain, and you see this on CAT scans and MRI scans that you do on patients who come into the hospital who are chronic heavy drinkers. They often will say there's volume loss of the brain, so the brain actually shrinks in your head. That's not like a temporary thing that goes away when you stop drinking. This is a permanent change. You're losing brain tissue, and brain tissue is function, and you literally lose your mind when you drink too much alcohol for too long of a period of time. And this can also be a subtle finding. It doesn't always present in such a dramatic way where you see a CAT scan with volume loss of your brain. You also see subtle findings in people who drink too much alcohol, trouble forming memories, trouble recalling events and details, problems formulating cohesive thoughts, problems with focus. It's similar to talking to someone with dementia, but often happens in people who are younger and is related to alcohol use. So alcohol directly damages nerves. It directly damages vessels in your brain that supply oxygen and blood to your brain. You could develop really bad thiamine deficiencies, and you develop what seems like dementia from alcohol. Sometimes it's slightly reversible, but often it's not reversible. It's permanent damage to the brain. It's really, really scary to think about. Everyone's focused right now on your brain health and dementia and exercising and nutrition to prevent dementia, but we're not talking about alcohol as much as we should. I found this citation that 1 in 10 people with dementia, the dementia is related to alcohol use. And when you look at younger people, meaning less than 65 years of age, that's considered young onset dementia, the factor is even worse. It's 1 in 8 people who have young onset dementia. It's related to alcohol use. You often see this starting in the ages of 40 to 50 years old. So just like you start getting chronic liver disease around that age, you start getting alcohol-related dementia. This is like the midpoint of your life, and especially nowadays, people are starting families in their late 30s. You're 40 and 50 years old, and people are developing dementia and liver disease from alcohol. it really doesn't seem worth it. It really doesn't. So this happens more in men than women, just by the raw numbers, because it seems like men are just heavier drinkers than women. But the amount of women who are coming in with alcohol-related problems is actually going up as time goes on. And women are a little more susceptible to alcohol in terms of the damage it does. And there's various reasons for that. But women get alcohol-related diseases at younger ages and with less use of alcohol. So you don't have to drink as much as a woman to get similar damage. So it's a little scary as well. And there's also, neurologically speaking, stroke, brain ischemia, and other, trauma from getting in a car accident, from drinking too much alcohol. That's also in that neurologic category. You get chronic sleep disturbances, which screws up your whole day-to-day life. So even if you're not a chronic alcoholic who's sleeping on a park bench, you can still have chronic sleep problems from drinking too much alcohol that can really affect your quality of life and mess up your brain in other ways and more subtle ways, and mess up your personality from not getting sleep, which also causes inflammation and all kinds of other health problems in your life. And chronic alcohol use is also associated with anxiety and depression. So is it the source of the anxiety, depression? Is it self-medicating? Is it some cycle of both? It's probably a cycle. It's probably all related in some way. But alcohol plus anxiety and depression is not a good combination. And then we have accidents and violence. So motor vehicle accidents, homicide, suicide, fights, all kinds of bad things, including sexual violence. Young women especially are unfortunately increasing victims of sexual violence from alcohol use. They either are drinking, or the men with them are drinking, or both people are drinking, and horrible decisions get made and rape happens and terrible things happen in that situation. So that's another problem related to excess alcohol use that maybe doesn't fall into this medical, liver, heart category, but is equally awful, if not more awful. And then we get to falls. So lots of people fall from alcohol. They blame it on their dog, or they blame it on tripping on something, but we all know that this is due to the effect of alcohol creating high gravity zones. And when someone drinks too much and they don't want to talk about it, they enter a high gravity zone where falls are very common. And it happens all the time. People come in breaking all kinds of bones, falling and hitting their head, and they blame it on all kinds of stuff that's not alcohol, but we know that it's alcohol. So falls are a big source of problems. And slapping into the earth with your body weight is never good. And then the last thing to talk about, and this is a little more wishy-washy, but probably just as bad as the medical stuff, if not worse, it's all the social harms of alcohol. Very hard to quantify these statistics, but from what I read, they say about 14 million United States adults have problems with alcohol that's caused social harm. They say that 1 in 10 children live in a home with a parent that has a drinking problem. This leads to broken marriages, broken families, broken friendships, domestic abuse and violence, homelessness, worsening mental illness, workplace issues, poor productivity, unemployment, eventually leads to loss of drive, ambition, motivation, goals, energy. And if you drink long enough, it can lead to loss of the soul. And that brings us to alcohol use disorders. So what is an alcohol use disorder? It's the long-term use of alcohol that causes a structural and functional change in your brain, and it causes distress or harm, both physical or with your functioning in life. And there's a way to figure out if you may have an alcohol use disorder. There's some questionnaires that you can look at, and they're pretty simple. And I'll go through one of them right now. So if you answer yes to 2 of these questions, or if your loved one answers yes to 2 of these questions, it's time to think about alcohol as a problem in your life. And it's time to start thinking about getting help. So here are the questions. And I'll link this to the bottom of the show notes as well. In the past year, have you had times when you've ended up drinking more or longer than you intended? More than once, have you wanted to cut down or stop drinking, or tried to but couldn't? Do you spend a lot of time drinking, or being sick after getting over the hangover or the after effects of drinking? Do you experience cravings for alcohol, a strong need or an urge to drink? Do you find that drinking or being sick from drinking often interferes with taking care of your home or your family, or causes job troubles or school problems? Do you continue to drink even though it was causing trouble with your family and friends? Have you ever given up or cut back on activities that were important or interesting to you, or gave you pleasure in order to drink instead? More than once, have you gotten into situations while you were drinking or after you were drinking that increased your chances of getting hurt, like driving or swimming or using machinery or walking through a dangerous area or having unsafe sex? Have you continued to drink after it was making you feel depressed or anxious or adding another health problem to your life? Have you had a memory blackout from drinking? Do you have to drink much more now to get the effect that you want than you used to? Do you find that when the effects of alcohol are wearing off that you have withdrawal symptoms like trouble sleeping, shakiness, irritability, anxiety, depression, restlessness, nausea, sweating? So basically, if you answered yes to any of these two questions, if these things have occurred in the past year in your life, it's time to think about alcohol as a problem in your life. So what do you do at that point? How do you get help? Where do you look to? Or if you're realizing that someone in your life has alcohol problems, then maybe it's not you, but it's your spouse, or if it's your friend, or it's your child, or it's your parent, what do you do? It's very hard to address this. There's a million reasons why it's hard. And by no means am I an expert in alcohol counseling or in treatment of alcoholism. I'm really not. But there are places that you can start. And the easiest place to start is just with your family doctor, because sometimes they can set you up with some resources to start the process of trying to stop drinking. There's groups that you can go to. There's behavioral treatments that you can do. Everyone knows about Alcoholics Anonymous. That's a great resource. There are other groups out there. There are psychologists that you can see. There are social workers that you can see. There are a slew of people out there that actually do treat alcohol problems, and many of these treatments are successful if the person is really going for it and is determined to stop. And it often takes many times of starting and stopping and starting and stopping and relapsing, and that's kind of what always happens. But at the end of the day, even if you're relapsing and you're trying, it's much more productive than just not trying at all and drinking yourself into an early death. It's better to try to stop 15 times if you get it right the 16th time than not to start the process at all. So I'll put a link in the notes below about where to start looking if you need help with alcohol, or if your spouse or your friend or your mom or your dad does. And again, a good place to start is just with your family doctor. All right, everybody, that's the end of today's episode. I hope you enjoyed listening and you found this information informative. Hopefully it was not too depressing, but I think that we have to talk about the darker side of the things that we do to ourselves. And while some of us can enjoy alcohol here and there, some of us can't. And it's very detrimental to our health as individuals and also as society. If you'd like to leave me a comment or a question, please do so. Find me on social media at RealGIDoc, or you can leave me an audio question or comment by using the link in the show notes. All right, talk to you next time.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.